Hello, I am Dr. Banarjee, Senior Consultant Orthopedic. I am shoulder specialist at Sakra World Hospital. Shoulder is the most mobile joint in the body. Because of its severe mobility, it becomes unstable. So shoulder has a 360 degree of mobility, and due to its inherent mobility, shoulder becomes one of the most unstable joint in the body. So when an individual sustains an injury and the shoulder dislocates, so when we reduce the shoulder joint and we allow it to heal, almost 50 to 60% of the time, the shoulder can redislocate again. The reason why it can redislocate is the ligament may not heal properly once it is reduced, or it may fail to heal. Even though if it heals, it may not heal in its natural position, and hence whenever the individual attempts to throw or moves the hand in a position of throwing, the shoulder can redislocate again. If the shoulder redislocates for the second time or third time, it means that the shoulder has failed to heal. So the reason for failure to heal is the shoulder anatomy by itself. The bone architecture is such that the ball and socket, the ball is bigger and the socket is smaller, so that the ball can slip out of the socket easily, and whenever the dislocation happens, the ligament would have failed to heal, or it would have healed in an abnormal position. And whenever the dislocation happens frequently, if the dislocation has already happened for many times, the socket or the bone would have eroded to a certain extent. Means the socket would have already become smaller. Along with the ligament tear, the socket also would have lost its bone. So there would have been a damage to the ligament, there might have been a damage to the bone, and this problem would have already, the ligament would have already attained a stage where it has lost its normal healing capacity on its own. So this is one of the commonest problem in shoulder joint. When it dislocates once and it fails to heal, it can dislocate again and again. So this problem has to be dealt surgically, where the ligament is repaired back endoscopically with a keyhole surgery. It is brought back to its normal position, it is repaired, it is sutured back, and then we allow it to heal in its normal position. So if this is not done, the bone will erode and the socket becomes smaller. In such cases, we have to reconstruct the socket with a bone graft either from a different place in the body, and then it has to be allowed to heal. So one should not neglect a shoulder dislocation. If it happens for the first time, it should be treated properly. And if you already have a recurrent shoulder dislocation, if your shoulder is dislocating frequently, you should not wait for it. You should not think that it will settle, or you should not think that there is no solution for it. You should visit a doctor and you should consult a doctor, and it should be fixed at the earliest, or else you will lose your bone inside. So you might land up with a bigger surgery later. So shoulder dislocation is a problem which has to be dealt surgically, and you should visit your doctor and get it fixed as early as possible.